Hello everyone and welcome to this new lecture. In this time we will talk about the radiographic cephalometry and we will explain to you some important points in this radiographic cephalometry. Starting with an explanation, a quick explanation of the radiographic cephalometry. It is used to diagnose the patients and their different developmental stages and to determine the treatment plan, to measure the deformities and the patterns of the bones, of the soft and hard tissue. In the soft and hard tissue, we use CBCT, computed tomography, cone-based computed tomography, and we can use MRI also. But usually we do the measurement with the radiographic cephalometry in orthodontist to measure some points. One of these points to be measured is called the cilla. This one is the first point that in the radiographic cephalometry. And to give you a quick review about this point, the cilla, I will read to you some explanation about what is the cilla and what does the cilla do in the book. So the cilla is the center of the cilla torcica. The cilla is the center of the cilla torcica. The midpoint of the horizontal diameter. It is a midpoint of the horizontal diameter. This is according to the 1947 definition of the cilla point of cephalometry. The cilla is the middle point of the cilla torcica, the midpoint of the cilla torcica. Okay, now let's move on to the second point, and it is the nasion. What is the definition of the nasion and where does it show up in the radiograph of the cephalometry? First, we talked about the cilla and we said it's the middle of the cilla torcica, and now we will talk about we will describe it. So the nasion, I will read some explanation about the nasion from the book. The nasion, the suture exists between the suture of the frontal, or it exists on the suture. This is according to a 1948 definition of the nasion. It exists on the suture between, or the suture between bones. Here is a silla. It is in the center of or between the frontal and nasal bone, the suture that separates the frontal and the nasal bone. It is the silla. And by the way, the silla is considered to be one of the unilateral points that we will present to you. And there are other bilateral points also exists on the radiographic cephalometry. Next, we have the anterior nasal spine. The anterior nasal spine, I will read the definition to you on what is the anterior nasal spine. So, most anterior point of the nasal floor tip of maxillae on sagittal plane. This is according to a 1971 definition. Most anterior point of the nasal floor tip of the premaxilla on mid-sagittal plane. This one is the anterior nasal spine. This was the anterior nasal spine. And now, after we have said some definitions on the silla and on the nasion and the anterior nasal spine, let's go and read something about the posterior nasal spine. This one is the posterior nasal spine. I will read some definition. So the posterior nasal spine is the bony posterior projection of the horizontal portion of the palatine. The bony posterior projection of the horizontal portion of the palatine bone at the midline. It is the bony posterior projection of the horizontal portion of the palatine bone at the midline, and it is opposite to the anterior nasal spine. There is a point called point A. Point A. On this point, it is very important point to be considered, and I will read some definition about the point A. So point A is the deepest midline point of the premaxilla between the anterior nasal spine and the procyon. Again, it is the deepest midline point of the premaxilla between the anterior and between the anterior nasal spine and the procyon. This is the point A. let's move to the point B. This one is point B, and the definition of point B, we have it in the book. The most posterior point of the concavity on the anterior surface of the mandible in the midline above the ponion. Again, it is the most posterior point of the concavity of the anterior surface of the mandible in the midline above the ponion. Above the ponion. Now we discuss the gnathion, and the gnathion what is the meaning of the gnathion? The most outward and everted point on the profile curvature of the symphysis of the mandible. The most outward and everted point on the profile curvature of the symphysis of the mandible. Another definition to the gnathion, it is the most inferior point of the chin. As you can see, the most inferior point of the chin. We will give you another definition for the gnathion. So the gnathion is the most anterior point of the chin. The gnathion usually is determined by selecting the midpoint between the ponion and the menton. The midpoint between the ponion. What is the ponion menton later? On the contour of the chin. Now let's talk about the porion. The porion. I will read the definition of the porion. And all of these we discussed are unilateral, of course. But now we will read more about them. And before we discuss the porion, we have to mention something. We have to mention that all of these points were unilateral points, but now we go to discuss the bilateral points, including the porion, and I will give you the definition of the porion. It is the highest point in the roof of the left external auditory meatus. It is the highest point, as you can see. I will show it and represent it to you. It is the highest point on the roof of the left external auditory meatus. Let's move on to the orbital. An orbital, what is the meaning of the orbital? It is the most inferior point on the lower border of the orbital margin. It is the lowest or the most inferior point on the lower orbital on the lower border of the orbital margin. It is the lowest what is the orbital? It is the most inferior point on the lower border of the orbital margin. Let's go to the next point, the gonion. The most posterior inferior point at the angle of the mandible. It is the most inferior, the most posterior inferior point at the angle of the mandible. And from its name, you can conclude the point. It means the gonion, someone who goes inferiorly, posteriorly at the angle of the mandible. Now to the articular. Articular is the junction of the posterior ramus plane and the superstructure of the skull. It is the junction between the posterior ramus or plane and the superstructure of the skull. A junction between the posterior ramus plane of the superstructure of the skull. Again, it is the junction of the posterior ramus plane and the superior structure of the skull. There is another definition to the articular, and it is the point of intersection of the dorsal contours of the process articularis mandibulae and the temporal bone. You don't have to give a great attention to the second definition, but the first definition is sufficient. Now these are the bilateral points, and I will move now to the lines, beginning with torcica and the N is the nasio. So this line is between the nasion and the silla torcica. Between the nasion and the silla torcica. Second line is called the Frankfort Line. Again, Frankfort Line. And the definition of this Frankfort Line is the line joining the orbital point and the porion. The orbital point and the porion. So where is the porion? The porion, I will give you some information about it. It is a unilateral point, and I will give you more explanation later. But you have to keep in mind that the Frankfort line is between the porion and the orbital. The SN line is between the silla torcica and between the nasion. So we have now the silla torcica, nasion, Frankfort. Frankfort is between the porion and the orbital. Now let's move to the next line. It is called the mandibular line. The mandibular line is the line joining gonion and menton. The line joining gonion and menton. And what is the menton? Some might ask. We haven't discussed the menton yet. But the menton is a unilateral line. It is opposite to the point B. It is near the point B, and it is at the chin. Let's go to the next line. It is called the facial line. The line joining nasion and ponion. Line joining the nasion and ponion. This one is the line. Next line is the Steno line. Steno line. So Steno line is the line that touches both lips between the nasion and the ponion, almost between them. And next we will talk about the Steno line. The Steno line. This line is between the tip of the nose. This one is not the Steno line. This one is the Frankfort line. The Frankfort line. Frankfort line. It is not the Frankfort line. It is the Ricketts line. The Ricketts line, because we already talked about the Frankfort line. This one called the Ricketts line, joining between the ponion and the tip of the nose. And in normal, upper lip should be away from this line by 2 to 4 millimeter, and the lower lip is away from this line between 1 to 2 millimeter. Again, Ricketts line, and it measures the aesthetic of the human. Now I will talk to you about a unilateral point that we haven't talked before about. It is the basio. What is the basio? The most inferior posterior point in the sagittal plane on the anterior rim of the foramina magnum, or it is the point at the center of the anterior border of the foramina magnum at the base of the occipital bone. The basio is the most inferior posterior point in the sagittal plane on the inferior rim of the foramina magnum, or it's the point at the center of the anterior border of the foramina magnum at the base of the occipital bone. Next, let's talk about the mentone, another unilateral point. The most inferior point on the symphysis of the mandible as seen on the lateral jaw projection. The most inferior point on the symphysis of the mandible as seen on the lateral projection. Last is the palatal line. Palatal line. It is joining between the anterior and posterior nasal spines. And I will read the definition to you. It is the line joining the anterior nasal spine and the posterior nasal spine. That was the lecture, and thank you for joining our radiographic cephalometry brief introduction of its points.